Dry needling is a treatment that uses thin filament needles in areas of the muscle that we call trigger points. And these are knots in the muscle that can either cause pain, they can cause stiffness or tightness, and overall lead to dysfunction of the muscle, which can result in injury, maybe caused due to an injury. So we treat those areas, which usually improves the overall function of the muscle and usually aids in your recovery. Dry needling helps with TMJ. We would needle the muscles that are responsible for basically opening and closing your mouth. So the muscles involved with chewing, talking, when you yawn, and the muscles there's 2 or 3 major muscles that we'd focus on. And I'd also focus on assess the muscles that cross the neck and the shoulder as well, because if it affects your posture. Some cases of TMJ may be resulting from whiplash from a car accident or from other traumatic incidents. So there's a few different areas I would look at, but mostly the muscles that are mainly involved with chewing and talking. Yes, the needling should reduce pain. If you have muscles that are overworking or tight, they usually will be painful. So if we can reduce some of that tension, there's a very good chance that we'll reduce the pain quite a bit. Yeah, every patient's a little bit different. Usually we have very good results though with the needling. Each case, like I said, on an individual basis. We set goals at the evaluation for the pain level the patient would like to achieve, and I would say 9 times out of 10 we are very effective in meeting those goals. I've had patients with 1 or 2 treatments where we've needled and they've felt 75% better. I would say on average though it takes 4 to 6 treatments, so if I'm needling a patient once a week, a month to 2 months, usually 2 months max, we should be at the results that we had set out to achieve. Not usually. It sounds like it would be painful because when you're talking about needles in the face or in the jaw, it sounds like it would be very uncomfortable, but it really isn't. The muscles are relatively close underneath the skin, and the needles are so small and so thin that oftentimes you don't even feel it breaking the skin or entering the muscle. The muscle will cramp or twitch a little bit when we hit that tight spot, which may be a little uncomfortable, but it's usually not very painful at all. Really, the biggest risk with needling for TMJ is if I'm needling the muscles of the jaw or the neck, it would be to maybe a minor bruise. There's really no major side effects that can result from the needling. Yes, if your insurance covers the physical therapy, it's the same as a regular evaluation for knee pain or for arthritis in your hip. There's no referral needed for physical therapy eval and treatment. What I like to do is, if you've been seeing your dentist or another physician regarding your TMJ pain, I will send them the evaluation and our plan of care and make sure they are on the same page. So there's a good line of communication between myself and the other practitioners that are dealing with your case.